Divya, Assistant Director of Company Event Visuals, welcome you all for today's webinar, where we have two professionals joining us from UK Live, Dr. Prashant Rajpal and Gemma Carlesimo. Dr. Rajpal is a neuropsychiatrist and has experience in working in mental health, specializing in neurology and treating psychiatric illnesses in people over 65. And second person, live from UK, is Gemma Carlesimo. Gemma is a psychiatric nurse, specializes older person mental health, assessing and treating organic mental illnesses. The session is going to be opened by Dr. Rajpal, so I kindly hand over to him. After they have discussed on the topic, we invite questions verbally or written and kindly state if you want to remain anonymous.
Thank you, Divya. Right, so the meeting is going to be staged. So I'm going to talk about depression, and then we're going to talk about cognitive distortions. It's going to be Gemma who's going to explain you a little bit more about that. And then we're going to talk about the treatment for the depression and what are the strategies we have. Okay, now, if you see the poster, it says, what is depression like? It's like drowning, except everyone around you is breathing. Now, I love this quote. It perfectly describes how absolutely alone and terrifying it is to be imprisoned inside the inescapable bog that comprises serious depression. You feel utterly helpless, laden, dull, unable to move. You are trapped, an unwilling witness to those living what appear to be happy lives. Now, anger at everyone's obliviousness is to your condition invades your lungs, heart, and spirit. The wave of pincer-like pain keep plummeting your brain as your body is dragged down, down, down onto the inky, cold depths of the ocean floor, choking you. The question, stay fetal-like or fight your way to the surface. When you're depressed, you don't control your thoughts. Your thoughts control you. I wish people understood that. The quote is painfully true. According to the World Health Organization, depression can make a person feel his or her mind has taken control over to the show, with self-attacking thoughts, tumbling after another with volcanic force. Says, I'm so stupid, everyone is looking at me and laughing. Nothing good ever happens for me. To someone beset with this chronic mental battering, the negative thought train, no matter how outlandish, seems entirely credible. Depression is a feeling like you've lost something, but having no clue when or where you last had it. Then one day you realize what lost is yourself. I don't recognize myself anymore is a common refrain of someone suffering from clinical depression. People will call your name, recognizing someone that they think they know. But looking back at you from the mirror is a stranger with a haunted, hopeless expression. You remember once experiencing anticipation and joy, but it feels like those emotions occurred in a far-off, never to be revisited galaxy. You recall happy memories like scenes from a movie once viewed, not as something personally experienced. I know I used to laugh and joke, but now all I want to do is sleep. More than one patient in the throes of depression has told me. Depression sufferers are trapped in a psychological, hellish twilight zone. My lips say, fine, thanks, but my eyes tell different story. My heart sings a different tune. My soul just weeps. Someone in the midst of deep depressive episodes feels like he or she is walking around in a shroud, suffering the torment of being physically alive while emotionally lifeless. When you force yourself to eat, food is tasteless. Rather than lighting yourself, lighting your soul, the sun rays feels like pellets against your skin. Whether your eyes are open or closed, existentially, all you see is a full eclipse blackness.
Go away.
Watching a comedy that's always amazed you, all you can summon is a plastic smile. You sleepwalk through your days, craving the little death of sleep to escape the torture of being awake. People think depression is sadness. People think depression is crying. People think depression is dressing in black. But people are wrong. Depression is the constant feeling of being numb to the emotions, being numb to life. You wake up in the morning just to go to bed again. Sadness is a common feeling in the kaleidoscope of diverse human emotions. It can be triggered by a terrible experience, such as going through a romantic breakup or listening to survivors of a mass shooting talking on television. You will cry, perhaps turn down social engagements, feel darkness, but in time the kaleidoscope will shift to a cheerier hue. A clinically depressed person is often beyond sadness. His or her feelings hidden deep beneath in throbbing wall of numbness. That's the thing about depression. A human being can survive almost anything as long as she sees the end in sight. But depression is so insidious and it compounds daily, making it impossible to ever see the end. The fog is like a cage without a key. The famous quote was taken from the best selling memoir by Elizabeth Wurtzel, Prozac Nation. It perfectly describes the utter hopelessness of enduring what feels like endless backlessness. Human beings need hope to lift themselves up. If your thoughts tell you there is no possibility of ever feeling better, the chances of recovering are dimmed. Then there is little motivation or ability to work in therapy for or partake in any pleasurable activities. Expecting the worst helps creating a self-fulfilling prophecy. Here's the good news. The cage can be opened when you begin challenging those hobbling negative thoughts. For instance, when you think, nothing good ever happens to me, then remind yourself this is not true. I found a wonderful person to marry. I found the best job. I have the best life. I'm content with what I have. When you suffer from depression, you say, I'm tired. Means a permanent state of exhaustion that sleep doesn't fix. Sleep just isn't sleep anymore. It is just an escape. There are few things more energizing than waking up from a good night's sleep, feeling refreshed and ready to tackle the day. Alas, no matter how many hours someone with overwhelming emotional fatigue that comes with clinical depression sleeps, or he or she awakes to that stomach dropping feeling of, oh no, I've got to get through another day before I can go back to the bed. no matter what age you are. Emotionally, you feel as if you are 100 years old. You drag yourself with leaden feet through daily chores, counting down the hours until you can lie down and shut out the world again. Hence, sleep is just isn't sleep, just an escape. The only thing more exhausting than being depressed is pretending that you're not. Severely depressed people feel they have no choice but to put on an Academy Award worthy performance of someone who's enjoying his or her time on the planet. However, there are huge emotional costs to hiding your truth, such as an increase in the sense of disconnect from others in your life. Having anxiety and depression is like being scared, tired at the same time. It's the fear of failure, coupled with no urge to be productive. It's wanting friends, but hating socializing. It's wanting to be alone, but not wanting to be lonely. It's feeling everything at once, yet being paralyzingly numb. Major depression and anxiety disorders often go hand in hand. Indeed, one study postulates that 85% of people who suffer from major depression also have generalized anxiety disorder, with 35% showing signs of panic disorder. There are similarities in symptomology, that is, irritability between the two illnesses. However, other symptoms are diametrically opposed, such as having no energy or try to make a friend versus being too terrified of rejection to reach out to someone appealing. The treatments used for these conditions are often the same. For example, cognitive behavior therapy works on the response patterns of depression, anxiety, and serotonin uptake inhibitors are also often used for both. The treatment strategies would be covered later in the session. It is estimated 1 in 6 adults have experienced a common mental disorder like depression and anxiety in the past week. Around 1 in 8 children aged 5 to 19 are estimated to have at least one mental health problem. Right, so let's summarize what is depression. In typical mild, moderate, severe depressive episodes, the person suffers from lowering of mood, reduction of energy, and decrease in activity. Capacity for enjoyment, concentration, and interest is reduced, and marked tiredness after a minimum effort. Sleep is usually disturbed, appetite is diminished. Self-esteem and self-confidence are almost reduced, and even in the mild form, some ideas of guilt or worthlessness are often present. The lowered mood is variable during the course of the day, is unresponsive to the circumstances, and may be accompanied by so-called somatic symptoms such as loss of interest, pleasurable feelings, waking up in the morning, hours before the usual time, marked psychomotor retardation, agitation, loss of appetite, weight loss, loss of libido. Now, depending on the severity of the symptoms, depression is categorized in mild, moderate, or severe. I hope everything what I've just said does make sense to you. I would like now to hand over to Gemma. She will talk about cognitive distortions, which are patterns of irrational thinking that cause people to make appraisals that are systematically biased in particular ways. Over to you, Gemma, please.
Thank you. So we all do have some cognitive distortion in our lives on every single day, but it's when we're depressed that cognitive distortion then takes over our everyday life. So as Prashant mentioned, it's an exaggerated or irrational thought pattern. In more simple terms, cognitive distortions are simply ways our minds convince us that something isn't true. And it's so negative, you think that something isn't true, you get into that pattern of thought, which makes you more depressed, which makes you more anxious. And it just keeps reinforcing that bad feeling about ourselves. So we all have maybe that friend who constantly seeks reassurance, or that friend that might cancel plans. So it might be worth thinking, actually, is that friend okay? Maybe they're going through a little bit of a bad time. Maybe it's a bad day for them. And they might be stuck in this circle of cognitive distortion where the thinking is just making them feel really negative about themselves. A good example is if you've just seen a friend and you've cooked them a meal and they go home, you might want reassurance about that and text them afterwards to say, was everything okay? Because in your mind, actually, they may go home, they may not want to speak to you again because they didn't like what you cooked. And that constant negativity drags a person down. But the good thing is we can challenge that, but there are 15 types of cognitive distortions. So that is a lot. I'm only going to mention a few. And like I said, some of them on a bad day we do have, and normally we'll be able to, brush it off and the next day will be a better day. So one aspect of cognitive distortion is called filtering. A person only thinks about negative aspects of a situation, which can cause them to dwell on it over and over again. So at a party, they might have not have thought that they were fun, and they might only see themselves. They might only see bad things that happened at that party, just negative things like I didn't look right or people were staring at me. So filtering is one of them things where anything that a person does, they only see the bad side and they will think everything about that situation is bad. Polarized thinking, or what we call black and white thinking, that can be a very restrictive kind of thinking on day-to-day life. So that person may think that things are either black or white. There's no in between. It's all or nothing, perfect or complete. There is no middle ground. And a person with this kind of thinking places people or situation in either or categories, and they don't allow for grey areas or complexity with people or situations, which we know as human beings we're all complex. Nothing is always black and white, and there is sometimes a grey area, and not being able to identify that can make a person look to be difficult, to be arrogant, to be challenging, but that just it's because their way of thinking, they may be stuck in that cognitive distortion, polarized black and white thinking. So it's sometimes good to kind of think, why is that person being like that? Could it be that they have, they are having problems in their life and it's not the fact that they're a horrible person? Another cognitive distortion, which we probably will have all come across, we've probably all come across everyone that I'm going to mention, and we've probably all experienced it within ourselves as well. So overgeneralization is another cognitive distortion, where the person comes to a general conclusion based on a single incident or a single piece of evidence. So, for example, if something bad happens once, they expect it to happen again. So, you could go out for a drive in your car, you have an accident, and then you keep thinking every time you get in your car that is going to happen again, and that anxiety and that builds up and up to the point where you're worried about getting in the car and driving. And again, that can be so debilitating. Having this worry, having this negative thinking all the time can really, really drag you down, and obviously cause problems with your mood. Another one Another cognitive distortion is jumping to conclusions. So even before meeting somebody, because you feel so negative about yourself, so low, so depressed, you might think, well, they're just not going to like me. So, what's the point? And they won't bother to challenge that or find out if it's correct. And that may be that they might not go and meet that person, or they might not go to that social event because they've already jumped to the conclusion that, nobody's going to like them. Another one is catastrophizing. I think we've probably all done this at some point in our lives, but it's about pulling them thoughts back and sitting back and thinking about it. So you think that, for example, oh my gosh, I have a headache, rather than thinking, oh, I'm a bit stressed or tired, I'll just take 2 paracetamol. A person, it's stuck in that cognitive distortion, all this negative thinking, will instantly think that they have a brain tumour, and they will catastrophize the situation. That's a really, really common one for people that suffer with anxiety, particularly around health anxiety. They will often catastrophize everything. If their child gets ill, they'll think that, they are seriously ill, and it causes problems. Then keep visiting the GP, and then they become, that person themselves becomes a nuisance, and people tend to stop wanting to talk to them. It's kind of that person, with these kind of negative thoughts, isolate themselves. Another one is personalization. A person may think or feel that everything others say or do is some kind of personal reaction to them. A person will literally take everything to heart, so everything personal, which often leaves that person comparing themselves to others. And it's so tiring if we are constantly comparing ourselves to others. And, with the likes of social media nowadays, we can kind of get caught up in this whole personalization. Everyone on social media seems to be happy, and particularly mothers, cooking for their children, you often see everybody's doing something perfect, and you think to yourself, oh, I don't compare to that. And that gets really tiring, and that really knocks a person's self-esteem, leading again, spiraling into this low, depressed mood, and feeling that you are sinking and that you are drowning because you're just not as good as that other person. Another one is blaming. Another cognitive distortion is blaming. So when a person engages in blaming, they hold other people responsible for their emotional pain. And they may also blame themselves for every problem out of their control. And you tend to find that people that do lack self-esteem will often say, oh, that happened, that's probably my fault, when actually it could have just been somebody else's human error or a technical error. But that's still that person with all this negative thinking will often see it as their problem and their fault. So there's another one, the fallacy of change. A person expects other people will change to suit them. That's a bit of a rarer one, particularly for somebody that has low self-esteem. But I think me reading through these cognitive distortions, I think we can all see that we've all had these thoughts happen on a day-to-day basis. But 9 times out of 10, we are able to control ourselves, and we are able to bring ourselves back to stop this pattern of negative thinking. But a person with depression cannot do that. And it is like a vicious circle. And like Prashant mentioned earlier, it is like a person is drowning in their own thoughts, their own negativity, their own low self-esteem, because of this cognitive distortion. And the good news is, which we will discuss it later on, it can be treated successfully, hopefully, but it does take some hard work when treating these types of problems. Okay, so back over to you, Prashant.
Okay, Divya, are there any questions we need to answer?
Yeah, Prashant, great. There is one question. First of all, GR, thanks for excellent presentation regarding depression. This question is for Dr. Rajpal. Given the climate of COVID-19, people, can you comment on how does it affect the brain chemistry and does it causes depression? What are long-term?
Okay.
What are long-term consequences in terms of depression following recovery from COVID?
Okay. So there's an emerging evidence on COVID-19's impact on mental health. Now, different groups of people in the UK are experiencing coronavirus pandemic and the lockdown very differently. On one area of concern is the impact of the pandemic on mental health and how it's affecting some groups much more than others. Good mental health is an asset, is also linked to good physical health, both of which support positive and social economic outcomes for individuals and society. Mental health disorders account for almost a quarter of the total number of ill health in UK. Poor mental health is strongly associated with social and economic circumstances, including living in poverty, low quality work, unemployment, and housing. There is also a well documented burden of mental health disorders following disasters, including evidence of previous viral outbreaks. Now, this suggests that COVID-19, the response to the pandemic, could have a significant impact on the nation's mental health, though increased exposures to stresses. Exacerbating this, there has been loss of coping mechanisms of many and reduced access to mental health treatment. How severe the effect would be, it generally depends upon individuals' resilience, the person's tolerability, the capacity to be able to live in those circumstances, what support and help is around with that particular person, and the general lifestyle. There is no direct or proportionate severity of depression as compared to the COVID or any other infections. So any other infections can lead to depression. Any infection can lead to depression depending on the severity of the condition and the severity of the effect of that COVID virus on one's health. It is almost difficult to say that when in the long term, how an individual is going to improve. It all totally depends upon the complication risen from the COVID virus and how long do you take to get better from those complications. Like, say, for example, COVID virus, one of the dire or dangerous thing arising from COVID infection is bacterial and superimposed bacterial infection, which might take a while, depending on how it is affected, how severely it has affected your organ systems, and as well the treatment what you have received. I will now like Gemma to talk about one of the treatment strategies, which I'm bringing that on the top because I will be talking about the medications a bit later on. The first and foremost thing people to understand the essence of cognitive behavior therapy and counseling. So we group together as a talking therapy. So Gemma, if you like to proceed with that.
I think it's important to say as well that the COVID-19 pandemic that is happening can obviously affect us with our cognitive distortions, where we can dwell and spiral into negative thinking about this virus, worrying that we're going to catch it, could we die from it? So the COVID-19 situation is, will affect everybody differently, and for those already predisposed to anxiety and depression, may affect them even more if they spiral into this negative pattern of thinking that they will get it or somebody in their family will get it, and they may die from it, which might lead them to not go out, isolate themselves for longer than they need to, and to constantly worry, not sleep, spiraling further into depression. So in order to treat cognitive distortions, CBT, cognitive behavioural therapy, is the first line treatment for any depressive disorder. The psychological therapy is really popular, particularly in the UK. You will automatically, if you present to the GP with depression or anxiety, they will make a referral to the local intervention team in order to deliver CBT. And cognitive behavioural therapy can be delivered face-to-face, over the phone, but you can even do online courses yourself, access all these online courses yourself, if you didn't want to talk to anybody about it and you wanted to tackle the problem on your own. It's very problem focused and action orientated, and like I mentioned earlier, it does require work from the person who is engaging in CBT. I know a lot of people that go for cognitive behavioural therapy expect to just talk to somebody, and they don't have to do anything, and they will feel better, their mood will lift. That isn't the case with CBT. It does take work. So the therapist role within cognitive behavioural therapy is to assist the person in finding and practicing effective strategies to address the identified goals and to decrease symptoms of the thought disorder. So it's really important that you do challenge your thoughts or these cognitive distortions in order to be able to treat them. So one question might be, if you have one negative thought, to challenge it is, how do I know that this thought is accurate? So it's about building evidence and really challenging what you're thinking, to stop the negativity, and what evidence do I have to support this belief. So it might be, if you have a headache and you think you have a brain tumour, you might think to yourself, okay, let's sit back and let's think about this. How do I know that this is accurate, and what evidence do I have to say that I have a brain tumour? So you're really challenging that thought and getting to the bottom of it. When we're doing cognitive behavioural therapy, Prashant's going to talk about the medication later. Studies have shown that it is most effective used alongside medication. So studies have found that CBT alone can be effective in treating less severe forms of depression and anxiety. However, used alongside a medication, it is more effective for the first time treatment in the majority of psychological disorders. And the good thing about cognitive behavioural therapy is it's fantastic for all age groups, from adolescents to children to older people. It can be used across all the age groups. So yeah, cognitive behavioural therapy, there's lots of homework, there's lots of things to do, there's lots of challenging, and you might find things out yourself that you might not have thought about, which may require some more treatment later on. However, it has been shown to be the most effective way of treating somebody with anxiety and depression. Okay, Prashant, do you want to explain the medication?
Thank you, Gemma. Okay, so I think we just had a question.
Prashant, we have one more question. Yeah, we have one more question. Do we have any other psychotherapy treatments for depression except CBT and counseling? It's a question for Gemma.
Yeah, there are other different types of therapies that you can engage in for treatment of depression. Compassion focused therapy is another one that kind of focuses on your anxieties and yourself, cognitive behavioral therapy, though, is probably one that you'd need to go down first before you would go down other routes, because it is more in depth and more detailed, and it may bring up more problems with regards to your treatment. So sometimes it may open doors that you don't want it to, and that then need more therapy and more help around. But there's lots of different types of therapy. Some people may engage in hypnotherapy. That's another good treatment for depression. There's lots of other things out there that you can do, but the research has shown that cognitive behavioral therapy, counselling, compassion-focused therapy, they're the ones that have all been studied and have been shown to be effective. Other therapies, not so much so.
Okay, thank you, Gemma. And I'm going to add a little bit on that. The other therapies which I would like to talk about is interpersonal relationship therapy, which basically looks after the relationships, how a person has formed relationships, and what has been the patterns of relationships since the person, since the person was born. So how it has developed over the period of time, what have been the disturbances in those relationships, and try and identify those patterns of disturbances and try and relate how the relationship problems have emerged and how it is affecting your personal life, mental health at this point of time. So that's interpersonal therapy. We have psychodynamic psychotherapy, which looks after, which explores the depression and anxiety, where exactly it is stemming from. So most of us might have had incidents or some sort of events in the past which might have caused us feeling the way how we're feeling at this point of time. And our feelings can be over exaggerated in a way, because we are probably been put into similar situations which has been stirring up the same sort of emotions as we've had in the past. Sorry,
Prashant, I also missed out EMDR as well. That's another therapy that we use here in the UK for people, particularly for people with post-traumatic stress disorder, intrusive thoughts, memories, nightmares. So EMDR helps the brain reprocess memories of the traumatic event by using eye movements. It can be quite distressing, but it has been shown to be really, really successful, and it's available here on the NHS. And also there's mindfulness-based cognitive therapy as well, which can help you focus your thoughts and feelings as they happen moment by moment. And that's also helps use depression and in some cases addiction as well. Absolutely.
Thanks, Gemma. It's nothing which is aloof. It goes in hand with you. We all have hurdles, we all have obstacles in our life. So we will get depressed at some point of time. Having enough support, looking after your lifestyle, not smoking or drinking within moderate amounts, reducing the stresses, engaging with more meaningful and interesting activities as you would like. So these are some of the things for an individual to look at, but for any individual, the strategy would be different. But what I've said is just the common strategies you might be able to look into. So that's what I'm going to talk about a little bit more on that. So the treatment strategies for depression depends on its severity of presentation and how it has impacted on one's life. So most of us might have had mild depression. So the approach we have is watchful waiting. So there is an evidence that suggests that exercise can help depression, and it's one of the main treatments for mild depression. Change in lifestyle, reducing smoking, alcohol, and maintaining healthy diet and healthy sleep. There are, self-help. You might want to talk about your feelings to your family friend, to your relative who you confide in. You could also read some self-help books, or as Gemma has just mentioned about cognitive behavior therapy, there are books on it. There are lots of online um, information available. Mild to moderate depression, if you have, it's a depression which is not improving, or moderate depression is you might want to have a talking therapy. As such, so there are different talking therapies which we have already mentioned about. Now, in treatment for the moderate to severe depression, if you have moderate to severe depression, then we recommend antidepressants. There are many types of antidepressants depending on the targeted symptoms. Now, the antidepressants as a whole, they impact on certain chemicals of the brain, and making those chemicals available in a specific part of the brain, which is called as amygdala, um, which controls our emotions. And the research study have suggested that the chemical imbalance can cause depression. So by giving those medications, it's slow and steady process. We try and regulate those chemicals in the neuron synapses, and by making those chemicals available from over a period of time, we would see that the emotional response to the stresses improves. Hence, your depression lifts. So it boosts your mood, and as well as a sequel of that, you would see that your other aspects of motivation, your confidence, your self-esteem, your concentration abilities, your attention spans, your ability to learn more information, hence your memory might improve. So there are a lot of people, as I said, the symptomology of depression could be so different, could be so variable for different people. There can be some symptoms of depression may not improve as when you start taking the medications. You would expect this to be a slow, steady improvement. We always suggest antidepressants along with the psychological therapy together, which we think benefits the most. Right, I think there was one more question, Divya.
Yeah. If both parents are busy earning bread and butter and the child is lonely during childhood and he or she is under depression, which comes out when he or she is a teenage, then how to deal this? It's for you, Dr. Prashant.
Okay. I think it all depends upon how you are bringing up the child. I'm sure that you are instilling your the best, your cultural and your traditional ways of upbringing. Um, it would be more relevant for the children who are deprived, not having enough parental support, not having enough economic um, backup, um, deprived of housing, clothing, and so on. So you would expect those people to have depression in the future. As long as you are giving as much of support systems to your child, we would expect the child to achieve the milestones, any milestones, as compared to the peers within that time frame. It's not only the parents, it's also the schooling. So that again impacts at large. I'm sure that school has counselors and, and advisors who would look into people or children who are struggling, and to find out at that very particular time what could be the trigger for the child to struggle uh, in studies, in academics, whether it's parent being not available, or whether it's being parental disharmony, In UK, we have children and adolescent mental health services. I'm not aware about that, whether we have it in India. We have different systems when we work in CAMS, children and adolescent mental health services, whereby we have support to the school, where we have support to the parents, we have support to the children.
I think it's really important as well, Prashant, with regards to children, is knowing what's going on in their lives and their friends as well. We've got influence. It's so different from when we were growing up now. We've got social media, we've got, television, children have got this image that they have to be perfect, just like, the celebrities. So I suppose it's about monitoring that and what they're seeing, what they're watching, what they're doing. And just making sure that it is, their perception of themselves, of the world, is a healthy one, not this skewed perception.
Absolutely.
Of, this perfection that it is all over social media. And, when we were younger, if we were being bullied at school, we'd come home and it would stop, but it doesn't nowadays. We've got mobile phones, we've got, the internet, and it's just about keeping an eye and monitoring, your children's friends' social media use and like I said, their thoughts of the world.
Yeah, absolutely. And beware of the stalking on social media, whilst if the parents are not available and not supervising a child over what the child's been doing, it's pretty dangerous. And it's now getting, it's upcoming more and more in the social medias, that, how a stalker making children, or they're targeting children, making them more vulnerable to exploitation. So one has to be very careful about what applications a child is using on the phone, and all what sort of websites a child visits, because websites may give ample of information which might be discreet and may not be suitable for a child to know. So it's all over supervising a child. Gemma, you have correctly pointed out children in school being targeted as bully. So again, the discrimination against ethnicities, race, and so on. So these are some of the things which have been highlighted, and it has been controlled by the school authorities. Anything else? Divya, any other questions? We have noticed that children, teenagers specifically, out of curiosity, might engage in some sort of behaviors which might result in harm to themselves, like sniffing, or might the playful activities which might be dangerous, and as well smoking cannabis or marijuana, or even having alcohol. Make sure that they are available for the children, making them understand what is good for them and what's bad for them, and clearly making them aware of the impact it might have on their lives.
There's one. Thank you so much, Dr. Rajpal and Gemma. It was a wonderful session, and we really loved it. And that's it. Thank you so much, everybody, joining this session. And I hope it was a fruitful session for you all. Again, I would like to thank Dr. Rajpal and Gemma.